So now, moving on to big bullet point number 4. We're going to take our sweet time in this video dissecting this because there's a lot to unpack and understand. But that is, core stability is not optimally trained in a manner in which lumbar movement is resisted. In other words, a movement where we are disallowing or not allowing lumbar motion to take place. So long story short, if I perform a dynamic resisted lumbar movement or exercise, one involving concentric and eccentric contractions of the muscles surrounding that area, that is going to yield quicker and more significant gains in core stability and really core strength than any core isometric exercise ever will. And by core isometric, I mean core stability exercise. They are synonymous. Core isometric, core stability, the exact same thing. There's a lot of terminology thrown around the internet. We're going to look at that a little bit more in just a minute. But when it comes to core stability, what does that mean? Let's talk about the differences between core stability exercises and dynamic core strengthening exercises. The major difference is that in any movement that is core stability based, there should be no discernible movement of the lumbar spine. So for example, if I demonstrate a hip hinge motion, I want my lumbar spine to stay neutral through the whole movement, okay? The lumbar spine has remained neutral there, so theoretically, I've got decent core stability in that movement, in that plane, and under that load. But if I did the same movement and I couldn't keep my spine neutral, you see it's rounding a little bit there, well then maybe I have some deficit in core stability. So in a core stability exercise, no discernible movement of the lumbar spine. Another example, I'll show you this one. This would be a suitcase deadlift. I'm going to be picking up a kettlebell with one hand. It's going to be my left hand here, okay? In this movement, I want no discernible side bending motion or rotational movement of the lumbar spine. And sure enough, I have none there, okay? If I was doing something like this, or maybe overshooting, and I couldn't control that, then maybe that would be a deficit in core stability. So core stability exercises, no actual movement. Now, if I instead wanted to produce movement of the lumbar spine, like this, that is not a core stability exercise, that is a dynamic core strengthening exercise, okay? So in core stability, no discernible lumbar movement. And somebody who is reasonably trained to observe for this should be able to look at a person move and discern that. And now this second bullet point. The individual segments of the lumbar spine should not be moving excessively relative to each other. If there's no excessive movement of each segment relative to the next segment, well then you have a situation where there is good stability. If you have excessive movement of one segment relative to the next, well then you might have some degree of lumbar instability, and that could be a structural instability, it could be a functional instability, that remains to be seen. But what that would look like is, let's say at the top this is L1 going down to L5 at the bottom. I could have a situation where let's say L3 and L4, that segment has some instability. Maybe L3 is moving anteriorly, excessively relative to L4. Maybe in another scenario, it moves posteriorly, excessively. Or maybe in a different scenario, it comes out towards the screen towards you. So there's a little excessive side glide one direction or the other, okay? There's already a normal amount of these gliding motions that's normal. But when that gliding motion in those various directions becomes excessive, that's where we start to have instability. And so if somebody truly has sufficient core stability, those excessive segmental motions of the lumbar spine should be non-existent. Okay, there's a little bit of motion, but it shouldn't be excessive. Now, this is something that is extraordinarily hard to detect. Under normal circumstances with functional movements, you probably won't be able to detect this. You might be able to get a feel for it if you do some spring testing with the patient in prone on their stomach. You might be able to feel maybe some excessive movements when you do PA testing, okay? So maybe the normal amount looks like this. Maybe if it's hypomobile, it really doesn't move. If it's hypermobile, you get some excessive movement like that, okay? But functionally, this is not something you're going to be able to detect. It has to be inferred from how the patient's presenting, maybe what you find during spring testing, maybe they have a positive prone instability test. But the one that you're going to be able to see globally is this first one, like we mentioned. If both of these two things are satisfied, it's very likely that the person already has good core stability in those directions, with those movements, and under the specific load. So hopefully by this point, everyone is on the same page. We have a crystal clear understanding of what core stability is, and also understand the difference between a core stability exercise, aka isometric, and a dynamic core strengthening exercise. What you see on this slide right here, this is a list of some of the really important principles of exercise selection. There are some scenarios where, yes, you might want to deviate from a few of these, depending on what the goal of the person is. There might be some very specific goals with some very specific exercises to achieve those. But in general, when we're just talking about straight strength and hypertrophy and getting the most out of your muscles, this really applies to every single muscle on your body that you might want to target. We're just simply going to apply these principles to the core. So, principle number 1, the exercise should be a dynamic resistance exercise involving both concentric and eccentric contractions against resistance. So, if you look at isometric exercises for a given muscle or muscle group and compare those to dynamic resisted exercises involving concentric and eccentric components, what you find is that the isometric counterpart is going to be inferior to the dynamic version when you're looking at almost any skeletal muscle parameter that you would measure. Strength, hypertrophy, power, endurance. Realistically, dynamic resisted exercises are just better. Bigger bang for your buck. Okay? Number 2, there should be a significant stretch on the target muscle or muscle group. This kind of plays into that stretch-mediated hypertrophy, maybe a little less applicable for strength, although you can get some really good strength gains out of producing a big stretch on the target muscle, but this is really more for hypertrophy. But obviously, if you're doing an isometric exercise, there's not going to be any stretch on the muscle because there's no actual movement. So if we're talking about core stability exercises, there's no stretch on the muscle. Unless you do it in like a really weird position and just hold this, or, I don't know why you would ever do that. But realistically, it's isometric. You're not getting a stretch on the target muscle. End of story. Number 3, the stretch on the target muscle or muscle group should occur at or around the point of peak tension on the muscles. So it's not absolutely required, but if you can pair the point of peak tension on an exercise to where you're getting maximal stretch on that same muscle, that is probably the biggest bang for your buck on that exercise that you're going to get in terms of hypertrophy. But as with the previous bullet point, if there's no stretch on the target muscle, which is what you would have in a core stability exercise, then there's no stretch on the muscle to pair with the point of peak tension. So it kind of defeats the purpose there. Principle number 4, the exercise should be easy to progressively overload. So there's many ways to progressively overload. You can add load or resistance. You could add some repetitions each set. You could slow down the eccentric component so it takes a little longer to complete that portion of the repetition. You could go through increased range of motion as it becomes available, although there is a cap to how much range of motion you can move through. But we're mainly focused on the resistance here. Now, when you are doing a dynamic resisted exercise, so with concentric and eccentrics, because there's motion involved, to get the same stimulus that you would get on an isometric exercise of a similar type, the resistance you have to use is way lower. For the isometric exercise, it's much higher. So as an example, let's use something we've already seen in this video, and this is going to tie into bullet point number 5 as well here. Let's take the standing kettlebell side bend and juxtapose that to a suitcase deadlift, which is a core stability exercise in the same plane of motion. For the standing kettlebell side bend, if I wanted to get an appropriate stimulus for strengthening and or hypertrophy, assuming I was doing a full range of motion and controlling the eccentric, well, I'm probably going to need somewhere in the 50 to 100 pound range to get that appropriate stimulus. If I do want the same stimulus for a suitcase deadlift, I'm going to have to load a significantly greater weight, probably something in the 200, 250 pound range to get that same stimulus. So generally speaking, to get those same stimuli, when you're doing a core stability exercise, the amount of load that you actually have to use is significantly greater than what you see for the dynamic version of the exercise. This presents some practical problems. For example, some people are going to have limitations in grip. Some people are going to have limitations just in general shoulder stability. I can't tell you how many times I've wanted to really load, let's say, a suitcase carry or a farmer's carry or something like that, and the person's limiting factor is their shoulder or it's their grip. That's not a good core exercise because it's become limited by something other than the core. Whereas if I'm doing a weighted side bend in standing and I'm only having to use 50 to 100 pounds, which I can pretty easily hold in my hand, the thing that's going to gas out first is my core. It's not the grip. That's what we want. We don't want something else to become the limiting factor. We want the muscle that we're working to be the limiting factor. We want that to gas out first, if anything. Okay? And something else becoming a limiting factor is much more likely to happen on a core stability exercise because they're isometric and because you have to use a lot more load, a lot more than some people think, to get an appropriate stimulus. Okay? Hopefully that makes sense. And principle number 6. This is really important because I'm not trying to be dogmatic about anything here. The exercise needs to be appropriate for the individual doing it. If I have somebody try a weighted side bend, or maybe I just simply doing active range of motion of the lumbar spine, side bending, oh, that hurts. I'm not going to load that up, right? If there's pain or dysfunction associated with those movements, then maybe core stability exercises are the regression that that person needs. But understanding that, yes, they are in fact a regression of their dynamic counterparts, I think we need to have a good understanding that that is in fact the case. But some people, depending on where they're at, may benefit a lot more from core stability at first, and then eventually once their back and other associated regions get better, then they can progress to the dynamic versions of said exercises. And maybe someone's job requires them to do a stability exercise. If we're not talking about the core for just a second, maybe the shoulder. I had a patient recently who tore her rotator cuff, and she's a waitress, so she has to be able to hold her tray like this. Now, I'll be honest, if we're talking about what's going to give you the biggest bang for your buck on strengthening the rotator cuff, well, for example, if we're talking external rotation, I'm a big fan of Balboa flies. I've talked about those in other videos. We can talk about that later on. But she would probably benefit a lot from a waiter carry, holding a kettlebell or a dumbbell like this, because that is similar to what she has to do at her job. So there's other things to consider other than, what is best practice and what's more optimum. But if we're just coming at it from strength, dynamic is always better, and it's much more practical. Now, I get it. There's probably a lot of people that are still not convinced. That was a lot of mumbo jumbo you just talked about. How could strengthening dynamically through a resisted range of motion where there is movement actually improve core stability where there's no movement? What we're simply trying to ask is, how could dynamic strengthening improve isometric strength? Well, I'm going to give you an example here that every physical therapist should inherently be aware of, and probably a lot of other people in other health professions. So the first question is, how do we strength test the biceps? Well, in any medical or physical therapy context, the patient is going to have their arm by their side, forearm is parallel to the floor. The practitioner is going to apply a force right here and essentially try to extend the patient's elbow. Of course, the patient's going to use their biceps and try to flex the elbow up. And the practitioner is going to deliver as much force as the patient can handle before it starts to break. And if you're doing this as a manual muscle test, typically, the strength is going to be graded out of 5. 5 out of 5 would be able to resist maximum resistance. And then, of course, you got 4 plus 4, 4 minus, and so on and so forth down. An alternative method, which I think is the best method, is to use a handheld dynamometer, which gives us exact pounds or kilograms worth of force that the patient is able to apply. And that's really useful because it allows us to see side-to-side differences. If, let's say, my left arm was good there, but my right shoulder or elbow maybe suffered an injury, let's say hypothetically the left biceps had, 50 pounds of force, the right one had maybe 30, okay? So that leads us to the next question. We need to strengthen the right biceps. How do we do that? Okay? Well, I can tell you one thing we're not going to do. We're not just going to take a dumbbell and hold it like this, right? I don't know of any practitioner or any athlete or any bodybuilder that got the most out of their biceps just doing this. What are we going to do? Well, we're going to have to move the arm dynamically in order to get the most out of that strengthening. So it doesn't matter what lift we're doing. We could be over here doing a Bayesian bicep curl. Okay, no one's just holding this position. Of course, we're going to flex the elbow and control that eccentric and progressively overload this. Maybe we're just doing a standard bicep curl, but of course I am doing this dynamically, controlling the eccentric, concentrically contracting up. It's dynamic. And then what we know is we then return to the strength testing 2-3 weeks later. We of course test the strong side. Maybe it's still 50, maybe it even went up a little bit, 55 pounds, let's say. I do this side over here, and guess what? It was 30, now it's maybe 48, 50 pounds, okay? What did I just demonstrate there? Well, when we strength tested, we did so isometrically, okay? This is an isometric strength test. Is it the full picture? Not necessarily. Well, the full picture would be looking at what I can do dynamically, and then I would be progressively overloading over time. So these 35-pound weights, eventually I do 40 and 45 and 50 and so on and so forth. But this is an isometric strength test. What we did is dynamic strengthening, and guess what? When we returned to the isometric strength test, the number improved. The strength increased. That is, the isometric strength increased. So long story short, what we're saying is that if you perform dynamic strengthening exercises, and of course progressively overload over time and be consistent, not only will your dynamic strength improve, as evidenced by your ability to lift heavier and heavier weights at the same number of repetitions, but your isometric strength will also improve. Very important thing to keep in mind, and this is something that should be intuitively obvious to any practitioner. Now I can already hear the rebuttals. You're talking about the elbow joint and the biceps brachii, right? That's like talking about the knee joint and the quads or the hip joint and the glutes. Those are simple systems. Of course that works. We're talking about the lumbar spine and the core. That's a complex, complicated system. And truth be told, to my knowledge, there has never been one good study done comparing the outcomes of core stability exercises versus actual good dynamic core exercises, because there's a lot of people that in the literature that don't really understand what a good dynamic core strengthening exercise is, but that's never been done, okay? But fortunately, there has been studies done like this on the neck, because the neck is a lot easier to study. And you say, but it's the neck, it's much smaller, that's not the lumbar spine. Here's the thing. The neck is just as complicated and complex as the lumbar spine. It's just smaller. And actually, the fact that it's smaller makes it much easier to study, and you could sort of use the neck as a model for the lumbar spine. The neck has the same basic movements. It has flexion, extension, side bending, rotation, quadrant, everything like that. It also has lots of muscles around it that have some redundancy with each movement. Each muscle is going to perform more than one movement, right? There's a lot of overlap. The neck is actually very similar to the lumbar spine. So here are two questions that are similar to what we saw with the biceps and the elbow joint, but applied to the neck, and particularly neck extension. How do I strength test neck extension? Well, I do a manual muscle test, an MMT. I can do it manually, or I can stick a handheld dynamometer back there and get an exact pound value for force, okay? I just strength test it, and that would be maximum isometric strength, okay? Isometric. Now, how do I strengthen neck extension? Well, what this study actually did is they took maximal isometric strength. They got a number for it. They also took maximum dynamic strength. And then what they did is they had the person over 12 weeks, and it wasn't just one person, it was quite a few people, but over 12 weeks, they gave them a neck strengthening program. And of the motions, one was extension, they had them perform dynamic resisted extension exercises. For example, you could perform neck harness extension like I'm showing right here. That's one such example. It's not the only one, but it's a really good one. But the point is, they never once did an isometric exercise. They only did dynamic resisted exercises like that with the neck harness. And what did they find? Well, they retested isometric and dynamic strength in those motions. And for extension, what we find is that progressively overloading neck extension gives you dynamic strength improvements. If I'm doing neck extension against resistance and overloading over 12 weeks, yeah, I would expect the strength to increase. Makes sense? Now here's the really interesting part, the kicker. By only doing dynamic resisted strengthening exercises in those planes of motion, for example, extension, what they found was that the maximal isometric strength also increased. And that increase was statistically significant. So we're talking about dynamic resisted exercises in a part of the body that is extremely comparable to the lumbar spine. It's just a lot smaller. But dynamic strengthening improves dynamic strength and isometric strength. And isometric strength of the lumbar spine is simply core stability. Now I'm going to leave you with one final point in this video. Core stability, shoulder stability, neck stability, hip stability, all this stuff. Stability. Stability on the internet as a term, I think some people have developed this idea that it's this magic, fantastical thing. But realistically, stability is just muscles' ability to isometrically contract, to literally stabilize and hold a joint in a given position, or at least control a given movement, right? If I wanted to hold my arm in this position and I pushed on it here, I don't want it to do that. I want to hold it right here. Well, this bicep is functioning as a stabilizer in this movement. It's functioning isometrically to prevent my elbow from going into full extension. So in that sense, my bicep is providing stability in that movement, but it's doing so by contracting isometrically. That is all stability is. It's a muscle's ability to contract isometrically. What provides stability? The muscles. What muscles we're talking about depends on the scenario, depends on the part of the body. But here is the final point I want to make. If a muscle has greater strength, it will be able to provide more stability. Muscles provide stability. Increasing the absolute strength of muscles increases the amount of stability that the muscles can provide. The degree of stability a muscle can provide is proportional to the absolute strength of the muscle. So if you want more stability to come from a muscle, you need to get it stronger. And then to get the muscle stronger, then we have to default to our exercise selection principles that we talked about earlier in this video. Performing specific core stability exercises at high resistances may require dusting off of motor patterns required to hold the specific position, but if you have the strength there, the stability follows, okay? For example, just because I'm sitting right here and you can't see my spine, if I'm doing a weight or carry, right, I gotta have isometric strength of the rotator cuff muscles, right? All the external and internal rotators, okay? If I go through a bunch of dynamic resisted exercises for strengthening external rotation, maybe particularly in this position, and work on strengthening the lats and the chest muscles and the subscat for internal rotation, and I get those stronger over a period of, let's say, 6 weeks, I guarantee you I could come back here and perform a weight or carry with more weight. Guaranteed. Why? Is it because I'm training this and getting better at this? No. It's because I trained the individual muscles that are providing that stability to be stronger, so then I can go and do this. Now, realistically, if I don't practice this, maybe I got to dust off some cobwebs and get the motor pattern there. But that's just a motor pattern issue. That's not a strength issue. If the individual muscles get stronger and they can provide more stability, I will be able to do more in that position there, okay? You want more stability, you got to get the muscles stronger because the muscles are what provide the stability, and the more strength they have, the more stability they can provide. I think I beat this horse to death. So, in the next video, we're going to see what are some of the best exercises. And I've already got some videos on my channel about that, but I want to actually make a really short and sweet video over strengthening the core in the various planes. Make sure to check that out. Please make sure to like this video, subscribe to my channel, and hit that notification for notifications for all videos in the future. Thank you so much.